La, la, la. Hey, hey. Yeah, yeah.
Hi, we're back.
Oh, hi! We're back. Good to see you.
We're just talking with Donna.
Talking with
over
Donna.
there.
You know what? It's a good thing we talk. This is a great show because we're talking nutrition. We were down doing a little bit of yoga down at Pranashanti, and now we're talking about the cold and flu season, and of course how to prevent it, how to treat it. And we are joined by one of our favorite guests here on the show.
Great to see you.
Let's first describe what exactly is a cold, what exactly is the flu, and how do you get it?
Okay. Well, the main difference between colds and flus is colds are caused by over 200 viruses, whereas the flu is only caused by 1 or 2 viruses each year.
Oh.
And they can change, and typically every 10 years we get a radical change in the flu virus. In terms of how do you get a cold, well, the main thing is we shake people's hands, they wipe their nose,
Right.
you know, that kind of thing. So if you actually focus on washing your hands, just like you just did, you can actually reduce that virus by 90%.
Wow.
And you can reduce the risk of developing diarrhea by up to 50%. So,
Wow, 50%, that's
yeah,
incredible.
So that's quite significant.
I'd say
And
so.
I'd say so too. And I'm glad you're talking about this because I think it's, you know, every child has the argument with the parents
Oh, yes.
about
I know where you're
about-
going.
Your
Yeah.
hands.
Put your hat on, you're going to catch a death of cold. Is this true or not?
Well, yeah, I mean, definitely you do want to have a hat on during the winter time. There's a great majority of surface area and that coldness can set in. A lot of people, when they get a cold or flu, it's exposure to excessive cold.
Okay.
Yeah, with perspiration.
Let's talk a little bit about prevention, because that's the main
Sure.
thing that we want to do. We want to make
Yeah.
sure we don't catch it. How do we, lifestyle-wise, how do we keep away from getting something like the flu or the cold?
Great. Well, the biggest thing is rest. During the winter time, people tend to have reduced exposure to sunlight, so we naturally have lower amounts of serotonin. So we do need to make sure that we get at least 8 hours of sleep. That really helps to significantly prevent a cold or flu.
Just sleep?
Just sleep.
Really?
Yeah, yeah.
I mean, this sounds so easy. We're having
Yeah.
this conversation so far. You're like, get your sleep, wash your hands. I mean, these are all
Wear a
things
toque.
that...
These are all
Yeah.
really, really basic things. I mean, what we want to keep in mind is that it's normal for every adult to get at least 1 or 2 cold or flu, or pardon me, a cold per season. A cold, you recover within 3 to 5 days and boom, you're back to work. But we want to keep in mind that the body has an innate healing ability, and it does this for a reason, because the time that you typically get a cold is typically when you're run down after exams, after a stressful time period. It's the body's rebalancing system. So it forces you to get sleep. But when people get lots of colds and flus, 5, 6, 7, or just a repetitive one, then there's something else going on.
Okay.
And the naturopath wants to figure out what else is going on.
How would you go about doing that with somebody?
Well, what we'd do is we'd gather a history, we'd do a urine test, and then certainly on my checklist, if a person's having frequent colds or flus, I look to their digestion. 70% of immunity.
You always go there. It's the
Absolutely.
root of all evil, isn't it?
It is. 70% of immunity is related to the digestive system, so that's where we get into food sensitivity testing.
Right.
The urine tests tell us about what's going on with the adrenal gland. Because if your cortisol levels are too high or too low, your immune system is going to start to show effect. So, yeah, those are a couple of the simple things that we can look for.
What about, I just wanted to ask you before we leave the topic of the difference of the cold and the flu, what about difference in symptoms? Because I think, I have a cold,
Yes.
I have a flu,
Yeah.
but I don't think we really know the difference. What are they?
Fair enough. Well, a cold is generally something that comes on slower, and it generally lasts 3 to 5 days. You might have a bit of a tickle, you might have a cough. It's generally not a really high fever. The difference with the flu is it comes on very suddenly. It's much more significant. You're really feeling unwell. There's achiness. Your fever might go up to 105. It can also last a lot longer. Once the actual fever breaks, which is 3 to 5 days, you can have a cough or feel generally low energy for 3 weeks after a flu.
Wow.
So you can see it can kind of drag on a longer period of time
Well,
too.
let's talk about treatment options,
Sure.
and in particular, natural treatment option.
Yep.
What's out there for us?
Well, you know, there's a lot of great things. One of the simple things you can do at home is sage. You can take an infusion of sage, just sage herbal tea, mix that with apple cider vinegar and a little bit of honey. The sage has an anti-inflammatory property and it tastes great, and that works really well, and it's a simple thing everybody has in their cupboard.
Right.
Ginger and garlic, both antimicrobial and really helps in terms of, they have antibacterial or viral properties as well. So those are two good options. More at a medicinal level where you'd want a naturopath's input, there's a botanical golden seal. Golden seal is fabulous because it actually stimulates the spleen, and the spleen is one of your major organs of immune response. So that's a really great botanical. One of my favorites is licorice. Everybody loves the taste of licorice. Yeah. And licorice naturally actually stimulates interferon. And interferon is how your body innately works against viruses. So it just has a natural ability to stimulate that whole process.
And this is great too, Joelle, because I mean, just like we were talking in the last segment about natural foods, people are really starting to want to eat natural foods. We're starting to want, I think, as well, to use natural options, keeping natural in our body. And these are all things, like you said, that we have in our cupboards.
Yeah, she just named 3 right in our cupboards. It's amazing.
Yeah. Well, it's been wonderful to have you. You've given us great advice on things we can do now for prevention and things we can do if we do happen to get sick.
That's right.
We're going to see you in a month's time.
Absolutely.
Okay,
Excellent.
good. All right. We're going to take a really quick break, and we'll be back right after this to tell you about our Spam-A-Lot giveaway.
Spam.